Welcome to More Than a Funeral, Voices of the Red River Valley, the podcast powered by Corsmo Funeral and Cremation Service of Moorhead, Minnesota, serving the Fargo, Moorhead, and surrounding area for over 67 years. More Than a Funeral, Voices of the Red River Valley is the podcast that brings you the stories, voices, and insights that shape our community. I'm your host, Tom Pence, and each month we'll be joined by local people of interest, leaders, experts, neighbors from around the Red River Valley to discuss the topics that matter most to you. Whether it's culture, business, history, or the issues that impact our daily lives, we're here to share, learn, and connect. If you enjoy today's conversation, be sure to share it, subscribe, follow us, so you never miss an episode. We'd love to have you join us for future discussions and continue bringing you more voices from around the valley. So sit back, enjoy, relax, grab a cup of Lutheran Church coffee to go with your Rice Krispie bar, and enjoy today's conversation. We're glad you stopped by. Good afternoon, podcast listeners. You are tuned in to More Than a Funeral, Voices of the Red River Valley. My name is Tom Pence, and I'm here with the co-host today, Sean Nygaard. We're talking here the end of November 2025, and I have to admit, I probably say this about every one of our guests, but I am excited about our content today. We are going to be talking about hospice. There again, I'm going to start saying Hospice of the Red River Valley, but it is now HIA Hospice, Hearts in Action Hospice. And today our guest, our friend here is Tracee Capron. She is the Executive Director of HIA Hospice. Did a little research on the website about you, and you're an RN, registered nurse, but the title that really got my attention was the MAOL. That sounds like I could read a lot into that, but I had to look that up. It stands for Master of Arts in Organizational Leadership. Ringmaster, ringleader, whatever you want to call it. It sounds like there's a lot of organizational skills. But anyway, welcome, and thank you for joining us on this late November afternoon.
Thank you. Yeah, the MAOL, it was interesting. I was going for my MBA.
Okay.
And I thought, wait a minute, it's more about the people. You know, why I went into leadership at all is I've had bosses and I've had leaders. And I thought I want to learn more about how to be the best leader I can and take care of people, because I'm a big servant leadership fan. Actually, I like to practice it on a regular basis, and I wanted to be able to take those skills and put them into action with greater tools. Mm-hmm. So I went for the Masters in Organizational Leadership.
Right on. Well, we're here really to talk about HIA Hospice, but can you give us just a few seconds on your road to HIA Hospice? At least that can be made public anyway.
Yeah, well, 10 years I've been here. I've made this my home. I've been in the Red River Valley for 10 years, okay. And I feel very blessed to have found my way here, kind of by accident, you know, and then someone had shared, you know, the position, thought this might be a good fit, okay. And I flew up and I met people from the minute I got on the plane that had volunteered for the organization, okay. I went downtown and people said, come have lunch. You know, I just found these wonderful people, and I'm like, wow. And then I pull up in front of the building, and the heart and the hands is what really drew me. So heart, hand, serve. But then I met the board, and they didn't ask me, how are you going to grow the business? Okay. Because I have a history. I was able to help businesses, you know, do well and serve more people. They asked me, how are you going to take care of the people? And that's what really got me. And drew me into Hospice of the Red River Valley. It was the board's focus on taking care of the people that work there, right on, and making sure that our care is the best it can be to the people that we serve. Okay.
Well, coincidentally, co-host today, Sean Nygaard, is on the board of directors of HIA Hospice, so he's got a good little input as well, too, and observations as well, too. But let's just talk a little bit about the early days, at least as much as you've been made known of. I'll refer to it, Hospices of the Red River Valley at that point. But I was reading an article on the website, which is phenomenal, by the way, for our listeners. It is hiahealth.org, and there is incredible information on there. But there was a story from Joy Query, am I pronouncing
Query.
that right? And Edie Herbst, and just a handful of community volunteers that got together, got this off the ground, and basically in the late 70s. And then after 3 years of fundraising, community support, they just finally launched in 1981. And that's really kind of cool. A comment that Joy made that I found quite interesting. It just talks about again, in my opinion, it's not work what you do. They stated she didn't find it difficult because she felt so sure of what they were doing, and so that just kind of reflects to me, the mission or the purpose of HIA Hospice. But maybe just give us a little background, if you, as much as you'd like to, about the past. But we really want to talk about the transition from Hospice of the Red River Valley to HIA Hospice. But could you just give us a little?
Well, it goes back to the Hearts in Action, right? It's our community, our volunteers started this program before you could even pay for it. Okay, it wasn't even a Medicare benefit. When the volunteers in this community jumped on board and said there's got to be a better way to honor people at this final phase of life, right? And how can we help and serve them? That it needed to be done the way you wanted it as the person and the patient. I call it self-determination. They help people have their choices honored and their wishes protected.
Right.
So they did that, and they built it literally from the ground up with a volunteer grassroots movement. And they grew. It started I heard in the broom closet. I haven't actually seen the closet. And grew it, and to what it is today is amazing, because they've come back and they've seen us, and I've talked to Joy.
Right.
And Edie, who was the original executive director, has come back to see me.
Wow.
Some of the people that work in legislation are interesting, part of the original founding core people in this organization that allowed me to be here, right? And our services have grown from their vision.
Right.
And their long-term vision was that anyone that needed care could have it. And I do believe that we're carrying that on with good stewardship and good care.
I believe that. I do remember when the offices were up in North Fargo, near the Northport Mall. And I remember bringing some flowers in there. And I can't remember the year, don't test me on that one, but I remember coming in there seemed to be just like a desk or two, and then a few plastic chairs around the perimeter, and there's a few things going on in the background. But I was amazed at that point. And if I had stopped the clock and then just opened the door to where you are now, I would have been blown away. So it's kind of cool that both Edie and Joy are able to still see what it's become.
Well, and Joy has passed since then, but Edie, I just talked to her not too long ago. She was in Arizona. And I come back, Sonia was one of the original, McManus was one of the original people that worked there, and she's still actively involved. And they were at our grand opening of Heather's house, the first freestanding hospice house in the state. Okay. And I'd like to say, too, is we're one of the last states to get it, to have one of these. It was a 20-year dream. 28 years ago, they started the dream
of
a hospice house.
I seem to... I think we talked about this, and I don't think I mentioned this yet, but November is Hospice Awareness Month, and there's probably been a lot of things going on that you can... Let's just talk about those now, if you don't mind.
No, actually, it was last week. So, bottom line, November's a big month anyway. So, it's National Hospice and Palliative Care Month, but it's Thanksgiving.
There you go, lots of turkey.
Yeah, and what's it about? Gratitude.
Yeah, good point.
Okay, and truly, was celebrating the people that work in the organization and the families that allow us into their home, right? Their heart in their home. Because that's really the heart of everyone, right, is your family. So it was an attitude of gratitude month.
Yeah.
And really acknowledging what we're grateful for. Grateful for being able to do the work we do and being allowed. It's a privilege to go into someone's home. That's the first thing. But how grateful we are to work with people that are such amazing human beings that are out serving. Yeah. These people in their final phases of their life. What a sacred time and an honor. So we celebrate it and gratitude to our staff and really that we're able to do the great work that we are able to do. It's a blessing. Yep.
I know Sean can also verify that in our profession, we're invited not by choice, into people's, well, sometimes by choice, invited into people's lives at a very intense and intimate period of time quickly. And same way with hospice. There's no pretense, if you want to call it that. I mean, when they're there, they're not trying to impress people. They're there for comfort and there for the final stages of their life. Yeah. I noticed it said in 1983, Hospice of the Red River Valley at that time became the first hospice west of the Mississippi to become Medicare certified. The first one, that's incredible.
Well, here's what's really interesting. So hospice as a whole, so we are the only community-based nonprofit in the state. Community-based, meaning we're owned by the community and the board.
Thank you for clarifying that.
Yeah, we're not affiliated with a health system or any large entity. I mean, we are strictly community-owned. What's interesting, we are what they call a legacy hospice. From that date in 1983, we're one of the few that are left. So in the hospice marketplace, 20%, less than 20% is nonprofit today.
Wow.
And does it make a difference? Absolutely it does, because it's
I
people
believe
over.
that.
Our national motto right now, and we're part of an organization that's all nonprofit legacy hospices in the country, and PHI, and it's people over profit is the motto, because we need to put people first. We have certain criteria you meet, right? Check the boxes for Medicare, but what else do you do? And I always say, when someone has hospice, and I can tell you from personal experience, you never know what to expect. That's how I got
Right,
into it.
right.
I was just so grateful. It took me 10 years. 10 years later, I still had feelings. I was so grateful that I had the experience, but then it's like there was a piece missing. And I couldn't figure out what it was, because I didn't know what to expect, right? That
Right.
personal experience. And then it made me realize, we need to exceed people's expectations, because you're so grateful to be home and in your home with
Right.
the people you love. But how can we be the best that we can be for everybody? How do we exceed expectations when you don't really know what you're getting?
Right.
Yeah.
Well,
Does that make sense?
We watch, just from when my mom was on hospice, I got to watch you guys exceed those expectations of what we even expected.
Right.
And when they came in, I was like, well, I've seen this before. We're funeral directors. We go into homes and we visit with the hospice nurse, we visit with the family, but we don't get to see the intimate side of what it's like to have a loved one at home on hospice. And I got to see that with my mom. And from that point on, I can see why people get wanting to give back, to be a volunteer. And it's one of the reasons when Tracee asked about being on the board, I was all over that, because I thought, you know what, I saw what you guys did with my mom, and I want to be able to give back. It was just a really nice experience, and we got to give my mom the blessing of being at home. That's where she wanted to be.
You honored her wishes.
Yeah.
Yeah, I say it's the greatest gift that you can give someone you love.
Is.
Yeah.
Yep.
I'd like to maybe offer a little confession here in both sides of the story, because there is a good ending to this. When I was in a small town in northwest North Dakota, way back in the 80s, when hospice was first starting to come into that area, as a funeral professional wanting my life to be easy, any type of hospice call almost seemed like it was in the way. And again, I'm admitting that
Yeah,
I was
no,
wrong.
I
I was
agree.
wrong. And because I was used to, we get a death call, and the call comes from the hospital, the body's in the morgue, nice and clean. We get in, we get out, nobody's there. 2 a.m, no big deal. And then the first time we started getting some hospice calls, it's like, family's going to be there. Oh, now I got to put on a tie. Now I got to put on a jacket. I got to shave. And at first I was a little, it's change. And as we know, change is not always easy. But now, like Sean, my mom had been on hospice care up in Minot. And I agree with Sean completely. I was, way off base, obviously, because I didn't know. But the experiences I have had with hospice in all situations has just been phenomenal. And so I'm not afraid to say that, because I'd be afraid to say that if I still felt that way. But no, I just think it's an amazing blessing, like you say, at that point in their life.
Well, I've been doing almost 30 years too, just so you know. So I can tell you exactly, I agree with you how it felt way back then. When you think about it, we didn't acknowledge until the 80s that people were going to pass.
That's right.
Okay, that's odd when you think about it, right? But when I first was in it too, it's evolved so much. We hear, it's non-aggressive treatment. Okay, that's not really true.
Sure.
We are very aggressive in our symptom management.
Yeah.
I can't fix your disease, but I can fix your symptoms because every moment matters, and how do we make your life better? That's the key. But back then, they literally came in and took away meds and sat at the bedside and did visual sitting. That's how it started in England, when it started over in England too. We've evolved. So it's like if you have, if you don't feel good, do you treat, if you have a respiratory infection, do you treat it with antibiotics? You do. If you don't, what happens? You don't feel good. Now, at the very, very final days of life, they don't work, right? But during that journey, yeah, we want to treat someone's infection. We want
Right.
to give you meds to keep your heart working, right? You know, there's some meds that don't work, and that's the expertise of hospice. It took me 30 years of figuring out and learning from pharmacists and doctors and all of us learning together. There's things that work really well. You know, but we are aggressive. It's aggressive symptom management. And how do we help people live well as long as they're here? Right? We don't like to make it shorter or longer. It's not my job. It's not anybody's job, I don't
Right.
think. But,
Not
you know, how do we help that journey in a good way? So when the funeral home came, yeah, it depends, because they didn't really want us there either. When we'd go into facilities, well, we do this. Why do you want us here? You know what I've learned, and it's kind of evolved, is like I go into a nursing facility, they have a whole different expertise that I don't have. They've learned things I don't know, but I know things that they can know. Together, we're good partners.
Yeah.
Just like the funeral home, now that we have Heather's houses, what should that look like? And we're going to learn through experience, like for the family and for the people come the funeral homes and ourselves. How can we make this the best experience for everyone? Mm-hmm. And that's what we work towards.
You know, and when you hear the word hospice, a lot of people go, "Oh, I feel so bad for that individual." But a lot of people don't realize that you can graduate off a hospice.
Yeah, about 10% at least graduate.
Yes.
Yeah, and it's kind of interesting. You know, our problem is we're getting people so late, like in those
Right.
last final days, and that's what people remember from back then.
Yep.
And see, so they didn't see people graduate. It shouldn't be a large I mean, it's a balancing. You need to make sure it's appropriate. I would say at the end of the day, okay, I'm just going to be really direct. I love hospice. It's my passion. I saw what it did for my family. You know, I was the nurse saving people, realizing that there was another way to do it I was working on the oncology floor.
Okay.
Okay, and I'm there, and then I got that call. And I thought, okay, morphine and not going to be here. That's what literally went through my head that many years ago, because that's how I was trained.
Mm-hmm.
But then I got this experience that was like, hey, yeah, I did give her a little bit of morphine, put her in her wheelchair, and we went shopping.
Right on.
I always tell her when TJ Maxx was open then, because we went there and spent money.
Oh, man.
You know, it was wonderful to see our family come together. My grandmother had what she wanted, where she wanted, and I saw everyone gather around. I call it a selfless act of love. It was all about her. It's all about her. Beautiful, right? This beautiful experience.
Yes.
But the fact of it is, every time I hear the word hospice for my family, no, I don't like hearing the word, because I know what's coming. And I need to prepare for it. I need it. But it's really hard because all of those human emotions and things, you know, that was my first experience, and then it was my son. You know? It was my other grandmother. It was my other grandmother than my son. You know, every time I'm like, really? You know, this is a lot.
Yeah.
You know, someone you love, and you know that there's going to be a time they're not going to be there. That's a lot to process. But at the end of the day, yes, I've always gotten hospice for them. And, you know, every moment matters, in the experiences of being able to be family and have support couldn't have been any better.
Family is a good word to use, because Sean will verify when we go to somebody's home after we get that call. We will frequently know the nurses that are on staff. They'll call us by name. We might have our name tag on, but they know us by name, and I won't mention the nurses offhand.
Yeah.
But yeah, and one of the things that really made a big difference for me, I can't remember where it was, but I came into the house and I could smell fresh bread. And I just use that as one example. It could be somebody cooking some kimchi or something like that. Who knows?
Yeah.
But my point is, you don't have the monitors beeping and the medical smells and things. You walk in and it's home. They've got the dog laying at the end of the bed, which we got to be careful about sometimes.
Yeah.
But it's home, and it's the dignity. I think that was a word that you used just a moment ago. Yeah. Well, can we talk a
100%.
little bit about the not transfer, but the transition from Hospice Red River Valley to Hearts in Action? Because you had said that word hospice, sometimes has a...
It's scary,
There you go.
okay?
Thank you.
Because it's reality hits you, right? And sometimes it's a reality, and a lot of times in our world, people don't want to talk about it.
Right.
Even you're a physician, doctor, nurse, whoever it is, it's a really hard discussion to have with someone. For some people, it's a definite skill set to have it, but I think it's a must because everyone deserves to have all the information they need to make the best choices,
Exactly.
right? And how do we do it in a sensitive way, understanding where a person's at,
Yeah.
right? So hospice what we noticed in this journey of hospice, right, is people needed help long before hospice. Oh yeah. Once you are dealing with a chronic illness,
I see what you mean.
it affects your whole family. It affects you. It's how do we make choices, the best choices for our lives, right? And we get to make those decisions if we're given all the information. So we saw this huge gap of people like before hospice, or we're getting hospice patients late, and we're like, why? Why are we getting them like 7 days? They're on service when we could do so much more for them. So what we found, and we call this upstream, like how do we start having these conversations from the minute, I'll use my mom. She's been gone 2 years. But back when it happened, she had a massive heart attack. I actually took her home on hospice.
Wow.
Okay? And then we did palliative care. Palliative care was new. So we do palliative care too that can take place. It's a conversation. It's like, let's look where you're at in your disease. What's it going to look like? Here's the things that could happen, could not happen, things you need to do, goal planning. We plan everything in life. Plan funerals,
Right.
plan how we live, plan what
Right.
we're going to do the next day, but we don't plan our entire health journey. And once it hits you, it's like, you better have a plan.
Right.
Okay? The better your plan is, the better your life will be.
The outcome.
So, yeah, so we got my mom on palliative care and got her controlled. She was out doing silver sneakers, was 15 years doing it. Yeah, it was super cool. It was super neat to experience. That's how I got into palliative care because I'm like, okay, it does work. It does work. Let's help her with her medicines. Let's keep an eye on her because I had to keep an eye on her and my dad, and get them to realize that, like, you need to tell me everything.
Yeah.
And we need to work through these processes. So people need help, long before that major incident. So how do we walk that journey? And we ended up in home-based primary care. We were one of the first. It become a new thing. The old black bag doctor going into your door. So we went to New York and the Cleveland Clinic and started looking at that because I'm like, we have all these dementia patients. And I'll never forget, it was like -50 out with wind chill or something. And a lady had fallen and broken something and we're having to transfer her out of a facility. I'm like, this is just wrong. Or the family trying to bring them out and they're used to their environment where they feel safe. So it's hard on the patients, hard on the family. So we're like, we need to take the care to them. Your living room's your waiting room. We don't have to bring you out of the house when it's not the best thing for you.
I hear that.
Home-based primary care.
Yep.
Yeah, so let's take the care to them.
Okay.
And that's been a challenge, but what drove it was our high dementia rates here. And we saw how it wasn't helpful for people. So we have started, and we're still working on every day as a learning experience of what we can do better and be better. So we started home-based primary care in conjunction with our palliative care. So now we have your doctor in the home, and we have hospice, and then we have palliative care all along this continuum. And we thought, okay, we're doing that. And then we got a grant from the state of North Dakota for what they call QSP, quality service providers. The state needed people that can train caregivers in order for them to be able to be paid to take care of their loved one.
Right.
So we have nurses, okay, we have trainers, we have educators. We can use them. We can help the state. We can help us. It was a mutually beneficial plan. But we also knew we needed non-medical transport because of the high cost, high dollar
Oh, yeah.
transport.
Yep.
It's astronomical,
Yep.
Yes, it is.
and we need to make that reasonable. So now we have non-medical transport that we're working and growing and building. So one of our hospice patients wants to go somewhere or needs to go somewhere, we can take them. Someone's coming into our hospice house, we pick them up if the family can't. If the family can't, it's always good for the family to come on that journey. So we have non-medical transport and we have QSP. So here we are. We're doing this. We have Heather's house now. We have a hospice house. We have more than just hospice. We've taken this care continuum. And we've built it. But how did we build it? We go back to the heart and the hands. And then that can never go away. That was our foundation, right?
Right.
Foundation of Hospice of the Red River Valley. And it's the top of our new logo, the heart and hands, red heart. And we kept that. We said we got to honor that foundation. Yes, a little picture.
I just didn't see the heart up there, yeah.
Yeah, that's our Hospice of the Red River Valley heart and our logo. And then we have yellow, green, and blue. We also have multiple satellite offices, okay?
Oh, yeah.
We grew, right?
Oh, yeah.
And we started evolving not only in these service lines, but, we're at Fargo Moorhead, and we're in Detroit Lakes. And then we met with Altru, and we took their hospice over. So we're up in Grand Forks. And then pretty soon now we're in Devil's Lake. And then we saw a huge gap in Ashley, North Dakota. The family that called in. And we called Jamestown and said, hey, can you help them? Nope, we only go so far. That's the story you hear all the time. So our team, we're in Baudette, Minnesota. They called every month for 2 years wanting help.
Wow.
2 health systems, but needing to go there. So the team, this is the people, the hearts in action, said, how do we make this happen? How do we get to them? So that's how we ended up in Ashley, North Dakota. Someone hadn't been home in 6 months, and they were young, and they wanted to go home. That's how we ended up in Ashley. We had 7 patients. Like, wow, Ashley, North Dakota, now I know where that is. Baudette, Minnesota, now I know where that is. So we're also in Minot and Bismarck. We're trying to make sure, you don't need, it's really Baudette. I'm going to go back there. So in Baudette, when we sat at the table with them, it was one of the people that was at the table. Her and her husband were planning how they had to move, how they had to leave their community, how they had to leave their home. I'm like, okay, this isn't right.
Yeah.
You shouldn't have to plan your life that way.
Yeah.
So how do we get care and make sure we have care in these rural communities? Why do you have to move to the other side of the state, to the city? Why can't we keep people in their home where they belong, in their roots, in their community, with their family and their friends, right? So that's how we ended up in these communities, because we can't just serve in the cities or the urban areas. We're a rural state. We're the breadbasket, right? So we have to serve people wherever they call home. So our vision from 40 years ago was care anywhere to anyone who needed it. And it's taken us a long time now. We're still not covering it all. A third of the state doesn't have community services. But and it can't just be a telephone call or telehealth. You need to be in the home to see what's going on, right? So that's how we ended up on these satellites. And they're color teams, red, yellow, blue, green. I said, we're all the colors of the rainbow. And at the end of the rainbow is hope. For your hope. New kind of hope.
Okay.
And we thought, gosh, Hospice of the River Valley doesn't say what we do.
Right.
Hearts in Action speaks to HIA.
Yep.
And I'm not going to go sit with you, I'll be honest, in health system or anything else, say I'm Hearts in Action. No, I'm HIA Health. I have a continuum of care, right? And I need you to be confident and feel strongly that we're doing these service lines and taking care of the people along them. So that's how HIA Health was born. We're way more than hospice. We have HIA Hospice, HIA Heather's House, HIA House Calls, which is our home-based primary care and palliative care. And then we have HIA non-medical transport. We're getting those as we build. And there's a few more things coming down the road.
I really like HIA heirlooms.
Oh, I got to talk about heirlooms. Love heirlooms.
We'll get to that in a second.
Thank you for reminding me, because that's an important part of our mission.
Yeah, there's some good stuff there. Anyway, what is, I guess, I looked at your printout and looking at the 4 levels of care, and I hope I'm
In
accurate.
hospice?
In hospice, right?
Yes.
Routine, continuous, general, inpatient, and respite care.
Correct.
To me, respite care is a high priority. Can you talk a little bit about that?
Part of what, so yes, I will. What really pushed us, I hate to say COVID because it's a word that I don't think any of us want to hear again.
We use it and we don't like to.
No, but we saw so many things that really brought to life. We're in the middle of deciding we are going to do a hospice house, because respite was a problem.
Yeah.
Okay, caregivers, best thing you ever do. But here's the bottom line. It's okay to need a break. And it's okay to gain resilience and to get some help. And honestly, sometimes the patient needs a break too.
They do.
And to know you have a safe place to go, that it's cared for and paid for, right? It's part of your Medicare benefit. So we are a Medicare certified hospice house, meaning Medicare, Medicaid, and most insurances, or you can talk them into, will pay for that care. You get a 5-day, 5-night stay. That's called respite.
Yeah. Mm-hmm.
There's a reason for it because it's hard and it's wonderful, but sometimes you need a break. So we had a big gap. People weren't getting a break.
Right.
And we're like, okay, we can use the hospice house for respite, and we are using it right now for respite. But the other thing we saw is, why do they need respite sometimes? Okay, it goes even deeper. Oh, maybe symptoms are out of control and they don't need to be this way. That's where general inpatient comes in, and sometimes even recognizing that tiredness or that break that you need, hey, maybe there's something we could be doing better with managing these symptoms.
Yeah. The person is too close to see it.
Yeah, and sometimes you don't want to see it.
Well, that's true.
It's the humanness
Yeah.
of us. Like changes, when things change, we minimize it sometimes just because it's easier to deal with.
Well, and as kids to parents, where you have one parent caring for a dying parent, it turns into okay, yes, they're caring for your mom or your dad, but you almost have to be caring for the primary caregiver.
Absolutely.
And this is where I love the fact that Heather's House provides this respite, because now those that are at home, you can offer this service and give your parent, who you're also worried about, a little bit of time off and a little bit of time to catch their breath.
And one of the first people that came, it was by accident. She was coming in the wrong door of Heather's house. And I happened to run into her, which happens to me all the time in my life. And I mean, she was just overwhelmed. And she was crying. She's like, I needed a break. And it was so hard for both of them. Yeah. And she was able to come there and be just a wife, or be,
right.
And let someone else help with some of the caregiving and take some of that burden off. Help people get in a better place. You're 100% right. We don't take care of caregivers. Or I don't think people even realize all that you go through as a caregiver. Yeah. It's very true.
Yeah. And I think most caregivers would acknowledge that nobody can care for my loved one better than me.
Oh, no. Yeah. No. And that's why, join us. Come in here and see what I always tell people, I told my staff this, they're just going to show up. I said, yep, and I'm going to tell them to just come right over. Yeah. Come in, take a look at what we do, walk in the door, and you'll know. And I would recommend that to anybody that is going, that their loved one, or even in the hospital. I don't leave my family. I go, and I stay. Yeah. I want to know that they're cared for and that I am confident in what's happening with them. Yeah. That's my responsibility to advocate for them, I believe.
Right on. Yeah.
And what you've talked about from expanding the functions of HIA, it's no longer just Hospice of the Red River Valley. We're not just in the Red River Valley.
Well,
we're stretching from almost the Canadian border, western part of Minnesota, to the South Dakota border.
Yeah.
That's more than the Red River Valley.
To what's on the other side, over past Bismarck, Montana? Yeah. I mean, when you think about it, right. It's huge. And the reservations that we serve, everybody deserves care.
Yep.
Absolutely.
In their home or in their community.
Yep.
Let's talk a little bit about Heather's house. 55,000 square feet. That's incredible.
Sounds like a big space.
Well, sounds, there you go.
So I will tell you, being good stewards of our resources, COVID, once again, COVID, we lived in a building off of 13th Avenue across from the mall. Yep. It's about 3,600 square feet.
Wow.
Yeah. And we had a dentist office and a piece of it, but we used the space, right? Now, Heather's house, this 55,000 square feet, is our administration and our hospice house.
Right.
Yeah. So we've condensed. So we multi-purposed a lot of things because our dollars and our care needed to go into basically the inpatient side.
Absolutely.
Yeah.
What amazed me, again, I just was on the website. I have not been out there yet, but there's a chapel, small chapel, of course, for quiet times, for that respite time. There's also a theater too, distraction possibly for little kids, but children's play areas. I'm just seeing a way that it invites the whole family in to be part of this process, not just you have two visitors per day and that's all you're allowed. I mean, it's a family
Let me tell you, when they got 20 or 30, it's a lot for us when you've got 4 in there. But, we have 2 guest suites, too. For the families we're bringing a lot of people from out of town, really, far away, because some of the cities I never even heard of. No, I'm serious, and they need help. right? You know, they were sending, someone was going home that honestly it was new meds and everything, and we're like, no, come to Heather's house, get their meds oriented. But the family's there, you know. I had a family have Christmas there already. Yeah, a couple weeks ago. But it's knowing that they can bring in, this was the other thing, they said bringing the little ones in, like the kids, into that. We have an incredible air filtration system. We're actually a hospital licensed life safety hospital. You wouldn't know it by looking at it.
Okay. Sure.
Yeah, but it's pretty amazing. But there's a place for the little people. I call them, like, you know, 0 to 5. And then you got a space for the teens, and you've got a place so when people are visiting with someone that they love in there, if other family members come, other ones can take a break. They can go out and get some food. May use the chapel. There's a little outdoor playground. For the kids, there's a walking path because it's okay to breathe and go outside and take a break.
Did I see a coffee shop too?
There is, and we're in the. It's not all built yet,
Okay,
but part of, we have coffee there right now. But yes, there will be our soda fountain. So there'll be a place for coffee, but also things for kids because you want kids. Here's the key. I knew when my son went in the hospice house that the biggest thing for me was I needed to be a mom, but I also knew that he could get into a lot of trouble, and I was right. And his, trouble as far as health trouble, like things that I shouldn't be dealing with at home. Okay. But I wanted to make sure his kids had the resources. So we literally had bereavement, meet them at the door, and the social worker start working with the family right away because I knew his kids were going to have a challenge. Mm-hmm. And this just happens naturally and organically. Yep. You get support earlier, and you're able to deal with it better.
Where we live in North Fargo, there used to be a daycare, kind of kitty corner. It's a long story. But my wife will frequently comment in the summertime that she misses hearing the children laughing. There's a little pool over there too, but I can envision that at Heather's house. Just hearing the kids laughing, hopefully not fighting, but that's part of life. But just hearing the kids, the children laughing and arguing, whatever, that's part of life.
So I brought very dear friends' kids into the hospice house. They've been coming there since I was building it. Literally, while we're cleaning up. The kids have been a part of this. So 2 twins, right? We've got, interesting. You know, they were 6 at the time, and an 8-year-old that were coming in there. So they still, every time they come over to my house, they want to stop at Heather's house. They want to go to Heather's house. And it's funny, they want to go to our skills lab. So Annie, we have a dummy where we train not only our staff, but we can help and train families on how to put someone in a bed, how to get someone out of a bed, and we have a special little training room for it.
That's special.
So that, yeah, it is, because nothing's worse than when you're in this, like, well, how do I do this? Yeah. You know, so you don't have to learn on your family. We can use our training room. We can teach you how to move someone, how to lift someone, how to do things.
Ankles break easily when you hit them with a wall. Yeah.
Well, these sound simple, but how do you pull someone up in a bed?
Yeah,
you know, those of us that have never done it, and that was me at one point in my life, right? We need to help people learn how to do this. But I've started to teach the kids. You know, we're doing Annie. They like CPR and Annie. But I was worried when we had a lot of people in there. I thought the kids they love going to the children's playroom. And Spencer Brandt helped do and design that because he's a young guy that works in our community. And he said, kids need to come in here and not think. So he made it like into this cabin, but kids love to be in there, you know, and there's like these interactive play things, right? So I thought, well, how's this going to be for the family that's sitting out in this room watching this? And I saw the one patient and her family come up, they were smiling. Yeah. Okay. And I thought, well, how are the kids going to handle this, right? I'm watching all these things. They smiled back. Yeah. Okay. And they continued to play.
Legos and whatever.
That's normal. Dolls, baby dolls, whatever. Yeah, it's all in there. Or they actually, 2 of them were fighting the fruit on the TV. But, you know, what I saw was normal. Exactly. What was normal in a family, right? The dynamics, the emotions. I think Heather and Dan Butler said it best. It's a place where you can laugh, cry, be happy. Mm-hmm. You know, that's what it's about.
And to give the dignity to that point in their life.
100%. I remember when my son went in, first of all, you arrive. What 34-year-old is in a nightgown without boxers, right? And tied to their bed, you know, and locked in a box, you know. Put on your clothes. Yep. Put on your baseball cap. Yep. Have your beard. Yep. If you want to eat, eat. If you want to go outside, go outside. Yep. I mean, that is dignity.
Yep, absolutely.
You know?
Yeah, we take that away at times, yeah.
We
all
do.
right, your eyes really opened when I talked about HIA heirlooms. So I picked up some good stuff there.
Oh, half my house is decorated from heirlooms. I love it. Plus, I love Steve. He's just got a knack for it over there. He just sets it up, and I'm like, oh, I couldn't imagine it looking like this. Plus, all of those proceeds go to help supporting the care, like offsetting those high costs in rural areas.
Yeah.
We truly put our money back into being a nonprofit, back into taking care of our patients, whether it being starting a primary care or building Heather's house. Our resources get used, and heirlooms is a lot of people. It's a hidden gem. They don't even realize it's part of Hospice of Red River Valley or HIA Health.
Right.
The money that they raise there from the generous gifts of the community, and our volunteers there, by the way, I love them. That's the best part. They're always smiling when you walk in the door,
I think actually
helping you spend money.
Yeah.
one of the persons that works with us actually, I believe, still volunteers at heirlooms. Yeah.
That's awesome.
Yeah.
It's a great experience, but I love going in there. Plus, you'll see they even have their regulars. It was funny. I was over there one day, and Steve he was talking to me, and he stopped because someone had walked in, and he just picked up on it, right? Someone had just lost their spouse. It's more than that. It's there's a connection that goes much deeper.
So we did not mention it, but I know what heirlooms is. You do, Sean does, but a lot of people may not know what it is. It is clothing, furniture, all kinds of things.
Small amount of clothing. When they use the word heirlooms, it's sometimes people donate. When their families pass,
Right.
or I don't know. I just dropped off a bunch of stuff from my house. That I thought, oh, someone else can use it in their home.
Right.
It's in great shape. Couches, end tables, decorations,
Lamps, absolutely.
Christmas.
Oh,
I got a lot of
That's
stuff for
nice.
the hospice house for Christmas over there too. They donated it to me
Right on.
for Heather's house, which has been helpful.
so people who are listening might have been thinking heirlooms. What's
shopping.
heirlooms? So yeah, there you go. Shopping.
They have a little gifts shop too with some brand new things in it too. But you never know, and every day is a different day. There, never someone else's treasure, right?
Well, Sean commented that after the experience with his mom, he jumped into being on the board, a lot because of that experience of having care for his mom. And I bet a lot of the volunteers that are at heirlooms and other areas too have that same feeling.
It's amazing, actually. And I'll talk about meeting you, Sean, in a minute. But I want to bring up something that one of them taught me. A couple of them did. And it was a couple of my volunteers that are in there regularly. I came out on a weekend, and one of them was in there working. A lot of them have had a hospice experience. And it's how do we walk that journey, and it's hard, and different days it's you miss people, I live it every day, but I see them gathering and making friends with other people that understand where they're at, and they truly do want to give back, and it is beautiful to watch. I feel honored that they're willing. Let's think about this. We have 400 volunteers, and I forget how many man hours we had, 56,000, 57,000 last year. We're the only part of healthcare that Medicare, right, the government requires that 5% of our hours that we work, 5% of volunteer hours are matched. If you don't have volunteer hours, you don't get a license. You can't keep your license. So how do we keep 400 people for 40, well, not 400, it was 350, I was looking at how much we've changed since 2017, since I got here. It's the only part of healthcare, so you've got a workforce, okay, that's working for free.
Yeah.
Okay? And they stay, and they put in countless hours, and they put in so much effort, from heirlooms to in our doors or at the bedside. Why? Because they see a purpose, and they see the good work that comes from it. And I think we all need purpose, right?
Absolutely.
So think about it.
I just noticed, even volunteering, sitting at a bedside, doesn't take a lot of skill, but it takes some good communication skills, obviously. But if all you need to do is, it's more than just sitting in a chair, but it's providing that comfort.
I always say presence.
There you go.
It's presence. Like I like both of you have a very calming presence. It's wonderful because I'm like vroom all the time, high energy all the time. But I can feel your calmness, and that's what I appreciated when I met Sean. And this is where I'm going with this. So, one of our board members, Nancy Andrews, she's board president right now, actually brought Sean's name forward because she thought he would be a good asset to us. What's funny though, I had come here to the Moorhead location, Coors Mill, right? In Moorhead. I didn't connect. I've met you several times, many times, coming into here for personal experiences. And I'm like, that's him. And it's been a great experience for me here because I saw how you treated the family that I care about, on this journey. And then I saw other people that I knew in these doors at a time that's really hard. You've just lost someone you love, right? But it really was about celebrating their life. It was about honoring who they were, which is what we want to do all through life. All the way, and 100%. You take it well, and you help that. You follow that same process, and I felt very honored. I'm like, okay, this is wonderful, because you understand.
Yep.
The family is the one that's left, right? So family makes a decision to have hospice. I call it selfless act of love to make it all about someone else. You do, because your whole focus is on them. You have to take yourself out of it because you're going to lose someone you love, right? And the patient's always worried about the family. So it's like this challenge, right? But to really be okay with someone and that final journey and to help them on that journey, they need to know you're okay. Mm-hmm. And then when you're gone or when you're planning that too, we choose people to be our power of attorneys. We choose those people because we trust them.
Right.
We choose our funeral homes because we trust them, and we need to honor that. And I see you honoring that on the journey. Mm-hmm. So I appreciated that, and I was glad that you were able to join the board. I had no idea that's who you were at the time because I had never really met you other than here,
Right.
And at that time, I'm focused on being at a funeral, right? Or a celebration of life.
Early on, as I look at the photos and the bios of the people on the board of directors now, it's such an incredible cross-section of people with, I'll just say advertising background, media background, medical.
Thank God is what I say.
Finance,
Thank you, Lord, for bringing these people. And I hope that's okay. I am going to say it because I truly believe it. Everybody's got a different skill set. I'm not an expert, and none of my people are experts in everything, right? But when we can bring someone onto the board that has a burning desire, I'm going to use DMF, Dakota Medical Foundation, a burning desire with bold dreams, and they're brilliant and they're able to deliver this, right? That's our board. They're these dynamic people that have a burning desire to serve, and they make big things happen. That's why we're able to do what we've been able to do. But we need experience too, like in all. I'm not a whatever. I'm not a funeral director, that's for sure. I'm not an advertising major.
You're not an accountant.
When we went into a rebranding, probably the hardest thing in the middle of building a hospice house, but knew we needed to change our name. So we tapped into our board people. Senator Barda and Tricia, they were people that had background in that. We need people to help us construction, building a hospice house. That was a challenge.
Right.
I have construction people on the board.
There you go.
So thank you for pointing that out. It's everybody comes with their own set of skills that they can help us. Like, I tap into them a lot.
Have to.
Well, yeah, because I need their help and I need their expertise or their ideas or, hey, can you check this out? I love the board. We need to expand that a lot, and we're working on that a little bit because we need to have board representation through our entire state and every community that we serve.
Yeah. Mm-hmm.
That's next on the agenda. It's
Neat.
one of the things that we're working on.
Well, it's fun. When I first joined Hospice, HIA's board, just watching everybody interact and just exactly what you said. Folks talking about different things that have a little bit more knowledge than the next person sitting next to them. It's a great mix of folks, and they bring that same passion, exactly what you're saying, to every meeting. And I'm learning yet, getting a good grasp on how things work, but I get to watch you, Tracee, in action, and it's amazing. You talk about being a boss, or you talk about being a leader. You mix them very well, and the staff responds. And from outside looking in, the staff seems to respond to that. And you might say, I got high energy, but that's what's needed too. And you bring all of that all those things to the table. It's just really neat to see.
Well, I appreciate you saying that, but for me, what I see is, and it's my team, okay? And I'm just talking, not just my team, but the people in there. I see we have two things in common, and that I see as common denominators with those that I work with. They truly have the hearts of service.
Yes.
And they have a faith that carries them a long way. And I will tell you, one thing about North Dakotans and Minnesotans, they know how to work hard.
They do.
They do.
But it's for helping other people. You know, I have people, and they work so hard and I see that. And it fuels me because I appreciate everything that they do. We could not do this without incredible people. The board, to my team, I have a great team. They do things, we've done things I never thought I could do, you know?
Yep.
And we start with yes, and I think that's the answer. Anything that comes our way, it may not look exactly how we thought, but it's yes, like how do we serve them? Yeah, now we got to figure it out. It's starting with yes. And that's what fuels me. Because we have a lot of people that need help in this area and this state. And frankly, we have a lot more work to do.
Yeah. Across the country, really.
Well,
Yeah.
but you know what? That's what's exciting to me. Is they say you can't get, we have this whole nation, right? Oh, you need care in these rural communities. You know what? We are doing it.
Yeah.
Could we? Well, and it's proven that it's sustainable.
Yep.
Financially, right? And that our model works in some areas. Now, granted, you need resources, and we have. When we've gotten them, we add the next piece. But it's doable. And North Dakota can set a standard. You can actually have people in the home caring for people in Baudette, Minnesota, and then clear on the other side, past Minot. I can't remember that city, the last one I went to, because I'm like, where is that?
Might have been Kenmare.
No, but
First of mine, Crosby.
That was one.
That's way up there.
Yeah, well, we do that too. But it's, our team wants to make sure people that need help get it.
And you've done a great job.
Crosby. It was Crosby was one thing we talked about.
You see the Canadian border, eh?
Well, hey, but I did up in Baudette. There's Lake of the Woods. Apparently you have to go to Canada to get back on the other side.
Because of the lake.
They didn't tell you that.
No, but it was super cool when I went up there. It's beautiful. So we have so many things going for us as state that I think that we can teach other people.
Yep.
Yeah.
Absolutely. Well, I'm living testament of that too, with my mom being rural North Dakota and hospice being able to come in there. We saw no blips in the care that my mom received there. It was truly amazing.
It's a blessing, isn't it?
It is a blessing.
That's what I was going to ask you, because the closest larger community would be Grand Forks.
Well, Devil's Lake.
What city were you in?
Edmore, North Dakota.
Edmore. Yeah, we went out to Devil's Lake because there was a big gap up there too. So we actually have an office up there now in what I call the mall. Probably not using technical terms, but you know what? That's a pretty big office right now. I mean, there's a lot of people that need help, and you know what? They spent their whole lives there.
Yeah.
When I came here, one of my things was I could do hospice anywhere. But I looked at the state and I saw, oh my gosh, there's so much more we can do outside of hospice. And it was interesting. So the Devil's Lake region too is, if you look at the population, but it may say 300, it may say 600, it may say 1,000, but there's still people in a community that live there that need care.
Yeah.
Right?
And chances are the people that are the caregivers, the people that volunteer with HIA, are from that area. So they have some comfort and confidence and trust, knowing that, like, didn't I see you at that Lefse baking?
Well, I can tell you it's amazing because everybody knows everybody. That's just what I found out.
Good,
I'm
good
like,
or bad.
I started in Larimore. I live there. They come into the hospice house. Yeah, it's very, very common.
Not always good, but yeah,
It
they
made
know
me,
people.
Yeah, and I don't know. I have to share something that made me think about. So last night I had just gotten off the plane. Had gotten stuck somewhere. I was driving in. I get into an Uber. And I get into this Uber. No, and why I'm telling you this is how little the world can be, right? On his thing between the front seat and that little thing you rest your arm on, he has a pocket cross that we have in our chapel and that our chaplains hand out a lot. And it's strapped to his thing. And I'm like, hey, where'd you get that cross? He said, the chaplain gave it to me when my mom was getting her last. Right.
Yep.
I'm like, really?
Small world.
It was. And then we started talking about, where they had come from. And I think it was, is it Independence? I don't know. I didn't even know the city.
Yeah.
Independence County? Is there Independence County? I don't know. It's someplace in the far side of rural North Dakota. But it just made me stop for a minute and made me realize, this world is really small. We've touched a life I never knew with this young kid, driving an Uber.
Yeah. Yep.
Right? You don't know how many people's lives you impact. And what the work we do is generational.
Absolutely.
So we have to exceed expectations, because that's going to impact how you are with your family and your children and your grandchildren. And every person that enters that hospice house, from that baby or 2-year-old that has the experience to the 6-year-old, generational impact, right? And we want this to be the best experience they could possibly have.
Sean can verify this, but we have had individuals come into funeral service when we have met them as toddlers. I can speak from an experience where I held the hand of a little child up by the casket, and I saw them 15 years later. They just graduated from mortuary school.
Yep.
Oh, to see that just takes your breath away.
Yeah, it does.
What an honor.
An honor and a validation that this is the right thing.
Yeah.
Yeah.
And why do you do it? You do it because you feel it's the right thing to do and you believe in it with your whole heart.
Yeah.
The same reason we do what we do,
Yep.
right?
Yeah. Well, let's start to wind this down a little bit. Again,
Sure.
I just want to remind people of the website that I spent about a half an hour on last night, because it's page after page after page of resources and information. But it is hiahealth.org. You'll find phone numbers on there. You'll see photographs, bios, and everything. But the resources on there range from nutrition, articles on stress reduction, holiday help. How cool is that? And also maybe handling some difficult family dynamics, because as we're talking here, we're talking the best case scenarios, but you guys also have to be trained in what do you call it?
Crisis management?
Crisis management, or not combat.
Informed trauma therapy, whatever.
Intervention, maybe, to some extent.
Do you know what? I think the biggest thing is compassion.
Yep.
Okay?
Yep.
And when you realize when someone's ill, okay, they're in crisis or they don't feel good. And I you never take things personal. You just try to step back and think, someone's dealing with something really hard right now.
Yep.
And every family member is going to handle it differently. Right?
Yep.
So that's where the dynamic. I have 4 brothers. How do you think that went? And I'm the bossy one, right? And I'm the nurse too, okay?
Yeah.
And my parents call me for everything. And then I got the brother
Smart.
flying in literally from California. That's what we joke about. The family comes in and then they start that. And then you've got all these people trying to give these ideas, and you want to hear them, right?
Yeah.
And they're learning. They're just learning some of the things that you've spent a year going through. It's so interesting, the dynamics and balancing that so everyone feels heard, everyone feels validated and appreciated in the answer to their questions.
Yep.
That's really the key, is just seeing what that individual family member needs.
Yep. Well,
You're right. It's really challenging at times, but to me, that's the best part, because I saw them get my family all on the same page and never had been. No, I'm serious. My dad and his brother and sister, that was like, whoa. And then I saw them like, hey, they came together on one thing,
Yep.
right?
Yep.
Their mom.
Yeah.
That was pretty beautiful in
Right.
itself. And then it was all about her, and they took care of her together. And it really changed their dynamics forever.
Good.
Yeah.
Well, we will put the website for HIA Hospice Health. On our website. We'll
Thank
put phone
you.
numbers on our website in the tags. And tell me a little bit as we wind down, and I'll have Sean kind of wind it up, finishing up some things. But tell me about the tree walk coming up here on November 29th.
Up in Thief River Falls.
I have no idea where it is. All I saw was
Oh,
tree
it's
walk.
not on there? Yes, it is. You have to get on our website, because if you ask me for directions, it won't ever happen.
What is the tree
I
walk?
GPS everything.
Yeah.
What's a
Yeah.
tree walk?
So they decorate trees, and here's what happens. A lot of people in our communities and all over, like Thief River Falls and Tree Walk, they raise money for us. Honestly, they do it, and they do it in memory and in honor of people.
Okay.
We have the Natowash Night Riders, the snowmobile people. Person that started it now, he passed, but it's still happening in honor of him. Or we may have JJ's Hog Roast in honor of his son.
Saw that.
Yeah, well, he wasn't on hospice, but they had our bereavement. So the tree walk is another way that community and those people give back to us with resources so we can keep doing the work we're doing. Does that answer your question?
Is Ole's Ride?
Yeah.
That's part of hospice.
Oh yeah, I went up there first time and I was like, oh my gosh, there's more motorcycles and there's people in this town. And it was really fun. I mean, I'm like, I have always white couple of their shirts I collect every year, but what gets me is all these people are doing something for people I don't even know.
Right.
I mean, think about how great that is.
Yeah.
You know, and then they donate to us. I mean, look at Heather's house. Okay, we raised. It was the $32 million campaign. We have about $4 million left to raise from our initial campaign, and we had experts come in and say, "Oh, this community, you won't have that support." They didn't know this community.
Yeah.
You know what I mean? So you and this community have built Heather's house.
Yep.
Just so you know. Thief River Falls and the Tree Walk and Ollie's Ride and JJ's and numerous others, right? You are the ones that have built HIA Health. So thank you for that. And thank everyone out there, because honestly, it wouldn't happen without this community.
We have a wonderful community.
Any last comment,
Yeah.
Sean, before I wind down?
I think just those that are listening, if you're in a spot where you're like, is hospice for me? Is hospice for my loved one? Tracee, what should somebody do if they're having those thoughts?
You know what? You call and you ask. And I would say, if you can, you get an in-person conversation with somebody. You can get all of that you can read on the internet.
Right.
But if you're questioning it, we call it an assessment, right?
Mm-hmm.
Have someone come out and take a look, because even if it's not right now, they're going to give you an idea and start formulating a plan for you for down the road.
Right.
And there's nothing like asking, because you don't know. Like you said, we start to, you see changes. I did it myself. And I'm good at this, right? I see changes and I'm like, they're just getting old. It'll be okay. We all do that. It's a self-protective mechanism.
Right.
But, when you start to think it or question it, you should always reach out and ask, because there's a reason. And if
Absolutely.
it's more than to get a plan. So that's a great point, Sean. If you even think it, you reach out and you ask, and you get as much information as you can so that you have a good plan for you and your loved one.
Tom, what's the phone number? You can share that if somebody wants to reach out to hospice.
Sure. HIA Health is 800 for all of us right here in town. I feel like I'm on the Johnny Carson show.
That's pretty good.
800-237-4629, and answered 24/7. I know that for a fact. Well, Tracee, thank you very much for
Yes, thank you,
taking a
Tracee.
few minutes
Thank you,
to stop on by. And for our listeners here, again, all this information will be in the notes on the podcast. We're nearing the end of December, Thanksgiving just around the corner, and this will be dropping the first part of December. So take care, have a good Christmas, good holiday, and thanks again for listening.
Thanks, everyone.
Thank you. Thank you very much.
You have been listening to More Than a Funeral, Voices of the Red River Valley. And I have been your host, Tom Pence, and I'm one of the funeral directors at Corsmo Funeral and Cremation Service here in Moorhead, Minnesota. The word service has been an intentional part of our name for over 66 years, and we pride ourselves on attention to detail and personal service. Personally, my responsibilities revolve around the advanced planning aspect of our profession, and I enjoy visiting with people as we discuss the many possibilities of a memorable celebration service that will eventually honor a life according to their wishes. And from a practical standpoint, which is getting so very important these days, I help families plan ahead so that the family left behind will not be burdened with a large financial responsibility, therefore allowing them to spend time with their family, remembering their loved one, not having to worry about how to handle the expenses. Asset protection is also a very real issue these days, as many care facilities can cost several $1,000s a month, depending upon the level of care. Corsmo can provide simple and effective ways of protecting those assets, and I welcome the opportunity to visit with you about that. If you enjoyed this podcast and found some value in it, we greatly appreciate your sharing with a friend. And if you have a moment, text somebody right now. Encourage them to give a listen and perhaps follow the podcast personally. We anticipate publishing a new episode on the first day of each month, so check back for interesting guests and topics. And of course, we also welcome your suggestions for future guests and topics of interest as well. So thank you for listening. And if you want more information and actually want some free estimates or just have questions, contact any of the directors at Corsmo Funeral and Cremation Service. Our phone number is 218-233-1533, and our web address is corsmofuneralservice.com. Thanks again for listening, and from all of us at Corsmo, have a great day.